Thank you for joining us today to discuss the patient options available in the WPS Secure Portal. My name is Karen Curtis and I will be your presenter. Joining me today is Mary Mugo. She is going to be helping me by watching the chat for questions that you may have and adding some additional information during the webinar. You've kind of seen her posting things in there already. Now today I'm going to show you a couple of functions offered within the WPS portal that will hopefully help you with billing for services and help reduce some eligibility related rejections that you may be receiving. I'm going to do that by briefly talking about how to register for the portal for those who may be new. I'll discuss the beneficiary MBI Lookup tool, and we're going to go through what information can be found using the beneficiary eligibility function. Now at the bottom of the slide is a footnote to let you know that there are legal disclaimers at the end of the slide deck. One lets you know that CMS does prohibit the recording of our webinars, and the other one lets you know that the CPT codes shown in this presentation are copyrighted by the American Medical Association. Now, the information that is being presented today can only be viewed by individuals who have registered with WPS. Because the portal contains protected health information and personally identifiable information, we must do our best to make sure that this data is only accessed by those who are entitled to have it. So when you visit the WPS homepage, there's going to be a large box with our logo, and the portal login box is going to be right next to it. It's what you see here on this slide. Now, if you click on other pages, the logo is going to disappear, but the login box is going to remain. Now, under the user ID field, you will see a link to register. Once you click on that, then you will be asked to accept the terms of use for the transactional area and the general area. The transactional area refers to specific actions that take place within the portal, such as data transmission or user interaction. And the general area is broader, and it refers to things such as data privacy policies or copyright information. After accepting the terms, you will be moved to the provider access page shown here on the left. Here you're going to enter your MPI, PTAN, your tax identification number. If you are part of a provider group or a clinic, then you must enter the group MPI and PTAN. You will not be able to register using an individual provider's information. When you self-register, a request is going to be sent to the MPI administrator for your facility or office, and they're going to need to approve or deny access. So this means that you're not going to be able to log in until your request has been approved. You can also have your MPI administrator create an account for you, and that would eliminate the approval process. There is also the possibility that you will receive a message about registering as an MPI administrator. That's shown on the right side of the slide. Now, this occurs if the MPI entered has fewer than 5 administrators. So if you don't get this message, there's no reason to be concerned. There's nothing wrong. It just means that you already have at least 5 individuals in the MPI administrator role. Now, if you are not the appropriate person to take this role, you can simply click no and continue with the registration process. But to accept the role of MPI administrator, there are certain financial information that must be provided. So you must have access to patient, payment, or claim information that would appear on a remittance advice that had been issued within the last 30 days. I include this slide just because I wasn't sure if everybody was aware of how the homepage appeared for other access levels. On the top, that's For individuals who have eligibility access, these users have the ability to check a beneficiary's eligibility and look up MBIs. They also have access to submit inquiries to customer service. And below is the homepage for standard users, which has quite a few functions available. The options that we will be covering today can be found on the patient card. So this second card right here. Now, MPI Administrator's homepage is very similar to a standard user. The only difference is that the MPI Administrator has an extra function between the My Profile and the customer service. It's called Users. This allows administrators to manage other users under their MPI. So we're going to start with taking a look at the MBI Lookup tool. For those who are eligibility users, this is going to be the second option from the right of their homepage. And for standard users and MPI administrators, this is going to be that first option on the patient card. Now, required information for using this tool includes your service location or MPI, the patient's social security number, their first and last name along with their date of birth. Now you're then going to you are then going to click search in the upper right corner. You will see there are other options to clear the fields or cancel the search. If the beneficiary information entered is correct and it corresponds to an individual with Medicare, then you're going to receive the following screen. The system will provide you with the patient's MBI, and then it's going to have options where you can either view their claims, you can view prior authorization requests, you can search appeals. There is a finalized claim summary, which allows you to view a single Part B claim summary. The next choice is to view the patient's eligibility information, which is what we are going to look at today. And then the final choice is labeled supplementals, and that allows you to check to see if the patient has a supplemental insurance. Now let's take a look at all of the information that the portal provides when you perform an eligibility check. Now, the eligibility information found in the portal does come from the HIPAA Eligibility Transaction System, which is also known as HETS. The information that it provides is accurate at the time given. So if you know that person's Medicare number, you can go straight to the eligibility checked option. For eligibility users, it's going to be the last option on the right of their home screen. And for standard users and MPI administrators, this is going to be the second option in the patient card. Now, the required information is going to include the MPI, the patient's Medicare number, the patient's first name or their date of birth, and the patient's last name. You will enter a start date of service and an end date of service. And this is going to determine the eligibility information that's provided because it's going to correspond with the dates of service that you enter in those two fields. Now, you can search for information up to 4 years in the past or for 4 months into the future. So that's just something to be aware of if you're looking for something that you don't just want immediate, they're getting service today type information. If all of the information that you entered matches a patient with Medicare, then you're going to receive this screen, which contains the patient information. In the upper right corner, you will see that you have the option to print all of the patient's eligibility information. You can print the information on the tab that you are currently viewing, or you can view the patient's claims. Now, I do want to call your attention to the two options that are above the patient information. Eligibility is going to show you the information related to the patient's benefits, but you also have the option to check if the beneficiary has a supplemental insurance with this option right here. So here is a look at what you can find for supplemental insurance. The portal will provide the insurance company's name and address, policy effective and termination dates, as well as the COBA number. This may not be a comprehensive list of all the supplemental insurances that a beneficiary may have, as it is limited to those that have signed a trading partner agreement with Medicare. A trading partner agreement allows Medicare to send claim information to the supplemental insurer after we process the claim. So that is one thing that would benefit you. If you see this, then you know that if the insurance is on the screen, we are going to send that claim information to them. If the beneficiary says that they have supplemental insurance and you don't see it listed here, then you are going to have to file a claim directly with that insurer. Now here is all of the tabs that are available for an eligibility search. Tabs that appear in blue have information, while those that appear in gray do not have any information. We are going to take a look at each of these so that you are going to know what information is provided. The first tab is going to be the summary of entitlement and benefits. Part A information is first, and it includes the entitlement date and reason the patient is entitled to Medicare. In the entitlement reason code field, you can hover your mouse over the code. So this right here, this is a number 0. You can hover your mouse over that and a definition is going to be displayed. So I'm going to show you an example on the next slide, but if I just wanted to let you know that that was there. If the beneficiary has had any time where they were ineligible for Medicare during your search parameters, those dates are also going to show. I do have an example. I did not put it in the slide presentation because this is from an email I received, so it's not real pretty looking, but I at least wanted to show you. It will show patient eligibility dates, and it will give the reason that they are ineligible, and it will give the effective date. So that information would also show up on the summary menu. You can see lifetime reserve days are shown, the base number of days for the year, and it also shows any days remaining. You can also find the co-payment amount for these days. Next, as you move down the screen, you'll have hospital days and co-payment days. Since the first 60 days of an inpatient stay are covered in full, then there isn't an amount that's going to show in that row. But the yearly co-payment amount for hospital days after the first 60 is shown here. And then lastly, we have the SNF full and co-payment days. Those are going to be listed along with the co-payment amount for the year. Here's an example of what it looks like when you hover over the number shown in the entitlement reason code field. For the number 0, a box appears and it states that the beneficiary is insured due to age OASI, and that stands for Old Age and Survivors Insurance. So not a great term, but that's what it stands for. Most likely this individual worked the acquired amount of time to earn 40 credits, which is about 10 years. So they would have been entitled to Medicare at the age of 65. Now, as you move down that summary tab, there's going to be the Part B entitlement information. This also has an effective date and an entitlement reason code. Remember that the Part B entitlement date can be different from the Part A date since Part B is voluntary and it requires a monthly premium. Now here you're going to find information on available benefits for pulmonary rehab. Um, Pulmonary rehabilitation program sessions are limited to a maximum of 2 one-hour sessions per day for up to 36 sessions. And then if medically necessary, they can have an additional 36 sessions. So that's where you see that number 72 coming from. Medicare does not pay for the first 3 units of whole blood or packed red blood cells that a beneficiary receives during a calendar year. So that would be where you can check the blood deductible information. Those pints are shown here. Now, although there are separate tabs for Medicare Advantage, which is known as Part C, and the Medicare Prescription Drug Program, which is also called Part D, you can find entitlement dates listed here on the Summary tab. Below that, you will find information on smoking cessation sessions. Medicare will cover up to 8 sessions within a 12-month period, so that data would be tracked here on this tab. And below, at the bottom of the tab, you're going to find session information for both cardiac rehab and intensive cardiac rehab. And it does separate out those professional and technical components of that. Now, I have pulled some data on the top rejections that were related to information that could be found on the summary tab, and these were what the results were. These numbers represent rejections from August through October of this year. The initial preventive physical exam and the annual wellness visits are something that the recovery audit contractors has reported as an issue. The initial preventive physical exam should be performed within the first 12 months of the beneficiary's Part B entitlement, and the annual wellness visit should be performed after the beneficiary's first 12 months. So by looking at those entitlement dates on the summary tab, then providers would be able to determine what type of exam the beneficiary should be receiving. So hopefully that would help resolve some of those rejections. We also have quite a few claims that were rejected for services that were received prior to entitlement or after coverage had terminated. These can also be avoided by using the entitlement dates shown on the summary tab. Now there is a separate tab for the Part A and Part B deductible. The Part A deductible starts out with the coverage dates. The Part A deductible amount is shown here in the base field. And then there's a field to show the remaining amount that needs to be met. Now, if the patient had had any prior hospital or skilled nursing facility stays, you're also going to see that on this tab. There would be billing dates as well as the billing provider's NPI, so that would be shown below this information. The Part B deductible tab shows the coverage dates, deductible amount for the year, and then any amount that would be left to pay. Next, we have the Preventive Services tab. For this example, I'm only showing a portion of what you can see on the tab because there was way too much information to try to fit on one slide. If you are curious about what services can be found on this tab, the Porter User Manual does provide a complete list in the eligibility check section. Here you're going to find information about preventive services that are subject to frequency limitations. So things like the annual wellness visit, diabetes screening, mammograms, things like that. The procedure code is going to be listed along with the next eligibility date. Many of the preventive services are provided without deductible or coinsurance being applied, but there are some services where that can be charged. So you might find information in those fields. You will see a column titled Modifier, and the examples shown here, you can see the modifier 26 for professional component. This column can also contain a modifier TC for the technical component. There's also times where maybe the professional component may have a different next eligibility date than the technical component, so that just be something you'd want to watch for. Information displayed is current eligibility data. You do not want to infer that the services were provided in the past. So for example, patients can receive an annual wellness visit annually, but just because this screen shows that a next eligibility date of like, let's say 2/1/25, you don't want to assume that they received the services in February of last year. So that's just something to be aware of also. I also did receive a question during the registration about services that are shown here, specifically the annual wellness visit, since G0438 is for the initial visit, while G0439 is for subsequent visits. They said that when they check this tab and it shows both codes with the next eligibility date, does that mean that code G0438 is available and that the patient has not had their first annual visit? I did find in the CMS their HETS companion guide, it did state that if no prior service history is on file, then no Part B financial information or prior service history will be returned. Since the WPS portal displays data received from HETS, this would lead me to believe that if HCPC G0438 appears in the eligibility search, that is because the patient has received that service. So that's just something that I found on the CMS companion guide. So that makes me think that if the patient didn't receive a certain service, that code's not going to show up here. Now, at the bottom of the Preventive Services tab, you are going to find the preventive service history. Here's where you're going to find the patient's vaccination history for pneumonia, flu, and COVID vaccinations. You can see that the code that was billed, it has the rendering provider's NPI and the date the vaccination was given. All of the information that I'm showing here today is from a test environment, so it's not a real claim and it's not a real beneficiary. Now, if we look at the preventive service rejections from August through October, the majority were related to frequency. I collected this data by looking at each of the procedure codes that you could use for billing preventive services, and then I kind of looked at the top denials for each of those codes. The majority of the claims were rejected for frequency. The second highest was billing Medicare when the patient had a Medicare Advantage plan, and then rounding out the top three was units of service exceeded. So the Preventive Services tab can let you know if the beneficiary has received a particular service and when they would be eligible to have that service performed again. Medicare Part D is coverage that helps pay for prescription drugs and is available through private insurance plans. If the patient is enrolled in a Medicare prescription drug plan, you will find information on the PDP tab. This section will list enrollment and termination dates, contract and plan numbers, along with the Part D insurer, name, address, phone number, a website if available, and their plan name. Now remember that although these prescription drug plans are referred to as Medicare Part D, these plans are offered by private insurers. So if you have any questions related to the patient's plan, you will need to contact the provider listed on this screen. Therapy caps. This can provide information regarding a beneficiary's therapy service threshold. Prior to 2018, there were financial caps put on therapy services, but the Bipartisan Budget Act changed this so that beneficiaries could receive the care they needed. These are now referred to as therapy thresholds or KX modifier thresholds. Now, this tab lists the type of therapy, the deductible year, and amount applied towards the threshold. Although only occupational and physical therapy are listed, speech language pathology services are included in the physical therapy cap. For 2025, the limit was $2,410 for occupational therapy and $2,410 for physical therapy and speech language pathology combined. For 2026, those limits have been raised to $2,480. Now, if we take a look at rejections for these services, 6,112 occupational therapy claims have been denied for being over the limit. This comes to a total of $868,702 in non-covered charges. For physical and speech language pathology, there were 21,903 claims totaling $4,560,096. So checking the therapy cap tab, it's going to let you know how much has been applied to the patient's threshold and let you know when you need to add that KX modifier to your claims. The Medicare Diabetes Prevention Program, this is a behavior change program that aims to prevent type 2 diabetes in Medicare patients who are pre-diabetic. This benefit is available once per lifetime. The Medicare Diabetes Prevention Program tab does provide information as to whether or not the Benny is participating in the program. You can find effective and termination dates for coverage, HIC picks for services that have been billed along with the date that service was provided and the billing provider MPI. Now, at the top of the screen, you see a period to end date over here up in this upper right, or I'm sorry, upper left section. The MDPP program is set to last 12 months. Originally there was an optional second 12-month period of maintenance sessions that could be provided, but that was eliminated in 2022. Now, additional coverage is for reporting data related to acupuncture as well as cognitive health assessments. Medicare will cover up to 12 acupuncture treatments within a 90-day time frame for chronic lower back pain. If the patient is showing improvement, an additional 8 sessions will be covered. So the maximum benefit would be 20 treatments within a 12-month period. This screenshot shows that the beneficiary has remaining technical sessions available along with the next technical date. And then there's also professional sessions remaining with the next professional date. The lower section of the tab is for cognitive health assessments. Checking for cognitive impairment is done as part of the annual wellness visits, but symptoms can show up during any other routine visits. If this occurs, Medicare does cover a separate visit to more thoroughly assess a patient's cognitive function and to develop a care plan. So if the patient received this service, then you would see CPT 99438 listed under the procedure code along with the rendering provider MPI and the data service. The ESRD tab is going to provide eligibility information for beneficiaries who are eligible for Medicare due to end-stage renal disease. You can determine when a patient's coverage started as well as when dialysis started. If the patient is entitled to Medicare only because of ESRD, then coverage will end 12 months after dialysis treatments ended or 36 months after a kidney transplant. The rejection information listed on the side is for claims where Medicare was billed as primary instead of secondary. The result that's resulted in 17,828,857 in non-covered dollars. Now, WPS does not process home health services, but the portal has a home health screen that can help you determine where to send your claim. Here you can find start and end dates along with the dates of earliest and latest billing. The home health agency MPI will be listed along with the contractor's name and number. The patient status code is also provided along with the NOA indicator. The example shows that the patient's notice of admissions included condition code 47, which indicates that they were transferred from another home health agency. WPS has rejected 2,707 claims from August through October because they overlap a home health episode. So using this screen to determine where your claim should be sent can help you avoid those unnecessary rejections. You'll notice that it also does list the contractor name on here. So in this instance, the person's claims would be sent to Palmetto. Medicare secondary payer rejections are consistently at the top of the list. 105,217 claims rejected within 3 months, totaling 82,375,306 non-covered dollars. The Medicare secondary payer tab can help because it will list the insurance plan that pays before Medicare. Now, checking the portal should not replace the admissions questionnaire, which can help you determine who the primary payer may be. You will want to still ask patients about other insurance plan at the time services are received or when they're being admitted. This tab will provide the earliest and latest effective dates. The insurer's name will be listed with a code description, which shows you the type of coverage, along with the policy and group numbers. If there's any diagnosis codes associated with the patient's accident or injury, those would also be shown. Additional information is going to include the patient's relationship code with a description, the date maintenance was last performed, MSP source, and if there is an ongoing responsibility for medicals or an ORM indicator. One thing I will also mention is that the insurer name, the way it is listed on this screen, is the way you want to list it on your claim. So if a patient has Blue Cross Blue Shield of Nebraska and it is all spelled out Blue Cross Blue Shield, you do not want to put BCBS on your claims. You want to put the full name. That will also cause a denial. Now, if you do have questions in regards to the information that is shown on this screen, you will want to contact the Benefits Coordination and Recovery Center. WPS does not have access to change any of this information. Another rejection that is always a heavy hitter for claims are claims that should have been billed to a patient's Medicare Advantage plan. So I have that information there at the top of the screen. The MA tab will show information regarding insurance that will pay instead of Medicare. These policies are also referred to as Medicare HMOs, Medicare Part C, or Medicare replacement plans. And here you're going to find enrollment and termination dates for the Medicare Advantage plan. The contract and the plan information will be shown along with the insurance provider's name and address. You will also find the plan name, the enrollment type, and the bill option code. This is an area that causes a lot of confusion. Our customer service and our appeals areas have said that they receive a lot of inquiries related to Medicare Advantage plans. If the beneficiary has an active policy through a Medicare Advantage plan, then claims should be sent to the provider listed on this tab. Also, these plans, this is all handled by private insurance companies. So nobody here at WPS has access to any of the information as to what this beneficiary's plan includes or any coverage criteria. Here we have the data for hospice rejections of claims that have overlapped a hospice episode. If the beneficiary elects to receive hospice care, then they agree to receive palliative care instead of treatment to cure their terminal illness. Information shown here will include the benefit provider ID, hospice start dates, receipt date, revocation date, as well as the revocation indicator. WPS does not process hospice services, so these claims would need to be sent to the contractor in your area. CGS is the Home Health and Hospice MAC for Iowa, Kansas, Missouri, and Nebraska. NGS handles the state of Michigan, and Palmetto handles the state of Indiana. You will want to pay attention to the revocation date and revocation indicator. This is going to let you know if the hospice is still active. So for the revocation indicator, anything other than 0 means that the hospice period has been revoked. The next tab is the QMB entitlement. A QMB beneficiary is one that is eligible for both Medicare and Medicaid. These beneficiaries will not pay for Medicare deductibles, coinsurance, or copays, but you may be eligible to bill the state's Medicaid program for these costs. Patients enrolled in the program have no legal obligation to pay Medicare providers, even if the provider is not enrolled in the state's Medicaid program. You can see that the screen looks a lot like the information found on the summary tab. In the top center, you will find the QMB enrollment period. QMB eligibility is determined monthly by the state Medicaid office. The enrollment information is also entered by the Medicaid agency, so Medicare can't guarantee that this information is going to be updated by the first of the month. Now, one of our coworkers, Tom Ryan, did hold a webinar back in May that was just on the QMB program. So I think Mary has already added that link to the Encore presentation in the chat. So if that's something that you're interested in and you want to know more about it, Tom did have a whole hour on it. So that would be something to check out. Now, the last tab I want to discuss today is the Part B immunosuppressant drug tab. I do apologize for not having a screenshot, but I wanted to provide you with the information that can be found here. Since this is all test environment, you don't always have as much data as what you would have in a real life environment. So patients who are entitled to Medicare because of ESRD may qualify for this benefit, which covers continuous immunosuppressive drugs that are needed to prevent or treat the rejection of transplanted organs or tissues. And this is only for drug coverage, and it doesn't include any other items or service. If the beneficiary has this benefit, then information that will be provided on this tab is going to include enrollment, reason code, coverage dates, deductible base, and remaining amounts along with coinsurance. Now, I do believe that I answered all of the pre-submitted questions within my presentation, so I want to ask Mary if we've had any questions come through in the chat.
There are no questions in the chat.
Great. Thank you so much, Mary. We will move ahead then. When you disconnect from the webinar, you are going to be redirected to a CMS survey. I'm also going to have Mary add that link in the chat. And I really hope that you'll take a moment to provide feedback on how I did today. If you are watching this as an encore, the link will be found in the description of the video. The redirect is going to look like what you see over here on the right. We don't have any control over how this appears, so we just want to let you know it isn't spam, it's nothing malicious. The feedback that we received does lead to change. Chapters have been added to our encore presentations in YouTube. These timestamps can be found in the descriptions of the videos. And it not only gives you an overview of what's being covered, but it also lets you jump to points of the video that interest you most. Training indicators were recently added to the description of our webinars to help you decide if the material applies to you. Although you can usually tell from the title, some of those training indicators that we may add could be FIS or MCS, so that lets you know that that webinar is going to be related to a specific system. We've also held 2 Medicare Education Expos based on suggestions for future education topics. We are currently planning a 3rd one that's going to be held in January, so be sure to watch for details of that to come out soon. I just wanted to give you these examples so that you could see that your opinion really does matter and it does lead to change. After disconnecting today, you should receive a thank you for attending email that will contain contact hours that can be submitted for continuing education units. If you joined only by phone, WebEx is not able to generate this email, so you will need to contact us. In the chat, Mary will add a link to the education mailbox and what information is needed for us to send a certificate to you. If you think of any questions, those can be emailed for up to 7 days following today's event. This does bring us to the end of today's presentation. On behalf of myself, Mary, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.